Hello all. Good afternoon and welcome back to two-day APAC Virtual Health Tech Innovation Conclave. This is the fourth edition of this prestigious conclave. And today we have eminent speakers, thought leaders from the healthcare fraternity here with us, the healthcare policymakers, healthcare thought leaders, and industry leaders and startup and innovators. In the inaugural today, we saw the presence of the MD NHM of Kerala, Dr. Ratan Kelkar, who shared his thoughts on how Kerala is building the comprehensive healthcare ecosystem by leveraging digital technologies and innovation. What are the challenges? What are the opportunities? We also see presence of GS Naveen Kumar, Special Secretary Health Government of Andhra Pradesh, sharing his thoughts on his vision on leveraging emerging technologies for the healthcare ecosystem. And also we had Dr. K. Madal Gopal, Senior Consultant Health, Niti Aayog Government of India, who shared the various aspects of National Digital Health Mission and how industry and government can collaborate together, state and state government can collaborate together to build that futuristic healthcare ecosystem in India by leveraging technology and digital innovation. And then we had an industry presentation by Kristen. And now we have come to a very important panel discussion of this two-day healthcare event. This panel is all about moving towards a resilient and sustainable healthcare infrastructure. And for that, we have with us Mr. Samir Mehta, Vice Chairman, Dr. Mehta's Multispeciality Hospital. We welcome Mr. Samir. Thank you so much for joining us. We also have with us Dr. K.S. Nayak, Chief Advisor to Board and Chief Nephrologist of Virinchi Hospitals, Hyderabad. We welcome Dr. K. Snack. Thank you so much for joining us today. As we all know that health system strengthening is no more an option. It is a necessity. Building a sustainable and resilient healthcare ecosystem should be the focus area for all the stakeholders associated with the healthcare ecosystem. Government, private hospital chains, industry, organizations all must come together and join hands to reach this goal. Intricate health security, emergency preparedness, and risk management requirements in health system strengthening efforts, along with adequate investments in research and innovation, is the way to move forward. But what are the challenges? What are the opportunities before us? This session will try to find answers to all the questions. So, with this, I'll first ask a question to Mr. Samir Mehta, Vice Chairman, Dr. Mehta's Multispeciality Hospital. Mr. Mehta, what are the challenges of building a resilient and sustainable healthcare system, especially in a country like India?
Thank you, Souvik. So, look, we've been in the healthcare business for around 89 years, and I use the word business very lightly. We were here when the British were in their eminence. We were here when the British left, and it was a very difficult period in the very early days because if you were friends of all India and perhaps not as friendly to the Brits and didn't follow their prerogatives, you were probably shot in those days. Uh, so weathering those storms where the payer was uncertain, where actually there was no payer most of the time, all the way to today where we have highly structured organized payers that albeit regulated are working on a playbook that perhaps is closer to a developed nation playbook on expectations, uh, I think is one which has added challenges. If you top that up with what we call consumer expectation creep, which is the expectation of a consumer going up consistently every period, which is fair, but it's also a little bit unfair when most of the expectations Dr. Nayak and me were talking about are based on a non-accountable doctor called Dr. Google, a person who can basically shoot off their content pages without being held to account for what's on their site. And that is what we're having to deal with in terms of the baseline for sustainability. So we have regulations, we have hyper competition, especially in a lot of the major cities. Uh, we have clearly a very evolved consumer expectation. And remember, health is still a state subject, but with international tendencies. We have people coming in expecting first world care at developing world pricing. And that's the challenge that I think sustainability encompasses. For us to move to precision medicine better, we obviously need a little bit of flexibility around pricing. And India has many outstanding engineers, but if you've tried hiring people, especially outside the clinical ecosystem recently, say technologists, say other critical roles in human resources and finance, you know the amount of expectation the market has to be able to be paid to these folks who work in other industries. So effectively, what you've got is healthcare as a cost percentage is controlled deeply by regulators or payers. Uh, and that puts a lot of challenge on sustainability because we still have to hire from the pool of talent that's available in India in most major cities. And actually, in cities, at least we have the privilege of having more people to choose from. When you hit many of these rural areas and tier two towns, the opportunity to find that talent is very scarce. And if you're competing against tech companies that don't expect you to sit in the same ballpark, non regulated ecosystems out there, this sustainability is very tough. So I think the challenge to healthcare providers is compared to the 30s and 40s of the previous century, it's a much tougher universe because of that expectation. And it's also a much tougher ecosystem because now we have very smart, sophisticated players, including the government, which we're very happy to say. I will be quite honest. I think the government helps us most of the time, but sometimes inadvertently also puts obstacles in our way to make us stronger and sometimes also give us challenges and sleepless nights. So I think that's where we are as healthcare providers. It's tougher. In fact, if you were to ask a generation of healthcare providers, next gen, whether they'd like to be in the same job, unlike perhaps most of the other roles like actors, actresses, sports stars, uh, tech people who see their parents at night, most folks like our kids don't actually sign up for it. That's the sense I have.
Right, right. Thanks for your insights, Mr. Mehta. If I take a crux of what you have said, that finding talent from the available pool, uh, cost is a factor, and also regulations, which is putting pressure on the existing healthcare ecosystem, and which also results in the growing doubt about the sustainability aspect of running a hospital ecosystem. I'll come back to you, Mr. Sami. Let's have perspective from Dr. Case Nayak. Dr. Nayak, your thoughts on that? What are the challenges if you talk about building a resilient and sustainable healthcare system in India, especially in the new world order?
Yeah, there are many angles to this. I fully agree with Dr. Samir Mehta's viewpoint. But the biggest problem we are facing now is we are equipped to deliver healthcare, but the patients don't seem to have adequate vitamin M, we call it, money, unless they are insured or they're being paid for by a third party. If they have to get healthcare at a cost which means selling properties, and if the family descends into poverty from a middle and lower middle class by doing some treatment which might run and into couple of what do you call 10 lakhs, 20 lakhs, uh, that is not sustainable. And I would think that the insurance companies, the awareness should, a lot of our patients are uninsured, and most of the government schemes don't seem to cover the higher end of the treatment that we are able to offer. India is a unique place in the sense that we have states which are the Bimaru states, which are having infant mortality, maternal mortality worse than sub-Saharan Africa. And we have cities like Chennai, Hyderabad, uh, Mumbai, and Delhi, where we have a surfeit of doctors, and the healthcare is on par with that available in the West. So I think equity is very important. Another very important area that makes me feel sad is the sex inequity of healthcare, where women seem to take the back seat whenever treatment is necessary. This is a very strong feeling that I get upset when the uh, people don't understand that the real breadwinner is both the father and the mother of a family. I mean the parents, because if the mother is not there to take care of the family, and if she is chronically ill or dies, then the children are likely to go into, uh, poverty, and the entire family is affected, both the father and the mother. But we seem to focus more on the care of the father. So this, we need to have definitely universal health care, which is sustained by the government, even for high end. Definitely, the government says that you can treat 100 malaria cases for one complicated knee replacement surgery. It is a valid, it was a valid argument about, say, 30 years back, 40 years back. Presently, it is no more valid. We should have primary care, preventative care, secondary care, tertiary care, and quaternary care all available, and the population should be able to afford it, or should be covered by the government. This is a sustainable care. One small example I'll give you. Uh, the we are hearing about a lot of patients who are coming, who are dying young now. Definitely, probably COVID related. But my daughter is a cardiologist in the United States. They say that they are able to save 9 out of 10 patients who get a heart attack, whether day or night. And the only thing that is needed is the golden hour intervention, which is primary angioplasty. And I'm very shocked that it is not being practiced, because there is no qualified cardiologist available in the night time in most of the hospitals in India. This is a glaring example. They are put on streptokinase treatment, and morning time when the cath lab opens, they are doing the angioplasty, by which time it is too late, because the myocardial muscle has a sustained irreparable damage. So this is only a small example I'm giving. So we need to develop on all fronts, and the healthcare is very important. Primary, secondary, tertiary, and quaternary should be affordable by the population.
But Dr. Naik, you talked about the problems. One problem you talked about the equity, which is not available. You get the example of some of the tier two, tier three cities, which is uh, performing poor even than the sub-Saharan countries. But at the same time, the doctors, available doctors in Chennai, Delhi, Bangalore, Mumbai, they're at par with the global standards. So that inequality is there. But and you also talked about the that government should come more forward in terms of taking care of the cost for uh, effective healthcare service delivery. But how do you change it? Because you talked of the problem, but what is your opinion that how can the solutions can be done?
I mean, it's very simple. Put more money into the healthcare budget. I think we have one of the lowest healthcare budgets. Union budget is what, 1.5%. It was increased. Our defense spending is I don't know by a factor of what, about 50 more than healthcare. They have left everything to the private health. They are slowly improving the government sector, but private public partnership is always looked at with skewed eyes by the government, that private players are going to make money out of this. They're not really interested in serving. How did we manage COVID actually in India? We actually did better than most big countries, and that was because of the private public partnership. But what did we get? The private hospitals got only the brickbats, and when expensive, nobody knew what COVID was when COVID came. But when we started giving them expensive medicines, we were pilloried for running up huge bills, and this is not the way to go. And I think there should be a good public-private partnership, and when private hospitals at the moment step in, it is taken with a pinch of salt. And um, we really don't know how many people in India had active COVID infection because of a poor collection of data. That is also very, very important. I'll give you an example. In kidney diseases, heart diseases, we don't have a registry. If you don't know the atlas of the disease in the country, we don't know how to solve the problem. If the prime minister sits in the and does an aerial view when there is a flood, and he gets an idea how much is needed. A similar, bird's eye view of India's problems have to be available, which in simple terms is, Dr. Mehta also knows, is a focus towards having a registry of all the diseases, especially chronic diseases, whereby the government gets an idea and then can plan a budget which is commensurate with the problem, not a 1.5% of the total budget that is allotted to healthcare. More money needs to come in, and universal healthcare is definitely the, we are paying taxes, which is not, we are paying our taxes, and the money should be appropriately used towards developing all the four levels of healthcare that I was talking about.
Right. I'll come back to. Thanks for those insights, Dr. Nayak. Mr. Samir, as Dr. Nayak was saying that put more money for the healthcare budget, and also need of the hour is the effective way of public-private partnership. That these two things can actually change the or transform the India's healthcare uh, story. Do you agree with that, or do you disagree with that?
No, so I think Dr. Nayak is on the dot. The amount of money in the system will obviously help, right? But it's not the only thing that can help. I think the good news with the government is, and you have to give the government some credit here, both at central and states, they actually did a pretty good job during COVID because there was no playbook and we had a very different situation than any other country. That being said, I fully agree with Dr. Nayak that actually the folks who not only took the government's back, uh, were to a large extent industry in general, and especially the private health sector. A lot of doctors, nurses sacrifice themselves. Some of them are deeply unrecognized within the ecosystem because they rolled up in places where there weren't enough PPEs. They rolled up at a time when there was no medicine in many cases that were the right part of protocols. But that being said, that's only part of the story, right? I think we hinted technology. India's got talents and we've got to learn to use our talents. America's got talents and weaknesses. We all talk about the fact that they've got a absolutely ludicrous payer system where there is no standardized price per person, right? So if you actually think about it, what is the concept of pricing is the fact that you have bands of prices depending on the services you offer, right? And therefore the product basket mix. The challenge that we've seen in parts of the world, America, is they've somehow ended up with an archaic system where the price is specific per user of a system. That has no sense to any of us. The second is they have clearly a liability reality where they pay more to a lawyer who is chasing an ambulance than to the doctor who treats the patient and saves the life of that patient. And there's something wrong with that. And then they have a benefit system that pays the patient oftentimes more to eat unhealthy food, right? So it's like a circle of continued stress. I'm saying let's leverage a couple of our strengths. Forget the weaknesses. Everyone knows about some of the weaknesses of India. That's no value talking about things. You ask for solutions. One is clearly technology. I think India has consistently been one of the market leaders in technology, whether you look locally from companies that are some of the top service companies in the world, whether some of the top software as a service providers in the world, whether you're looking at high precision engineering, or actually, if you look at the other parts of the world where Indian engineers represent the largest population of space scientists, venture capital investors, and to a large extent, Silicon Valley investors or entrepreneurs, sorry. So the talent in India is remarkable. Our doctors and our nurses are welcomed everywhere in the world. And I will tell you without a doubt, if you take away the racism component, most people across the world will probably prefer an Indian doctor minus a doctor who speaks their home language, who was brought up in their own city or town or area. So even if you go to North America, a New Yorker would probably prefer a New Yorker first and then an Indian doctor before an LA doctor, right? And that is a pretty consistent story anywhere in the world. You go to the United Kingdom, it's the same. You go to Australia, it's the same. You go to the Middle East, it's the same. You go to Singapore, it's the same. The same is beginning to happen with nurses. The challenge with nurses is a little bit different. Just like Indian doctors 50 years ago, when they went abroad, they had to learn to integrate into the cultures, to learn the local language, to understand the local following. Indian nurses just need better communication skills and confidence. right? Actually, they're very strong. If you ask me, my top nurses in my hospitals, I'm sure Dr. Nayak will also agree, in his hospitals are probably on par with the best we see in other parts of the world. And in fact, many of them have hearts of gold because they sacrifice much more to be with the customer to make sure that the patient's family is well cared for. So I think if we leverage these two resources, which is number one, technology, number two, the talent access we have in India, and I would add a third thing to that, we have to start learning to work together a little bit. Dr. Nayak has a number of best practices in his hospital. He has a lot of things that are going superbly well that he has figured out the jugaad way or the practical way to make things better. Unfortunately, the mentality most of us have grown up with, whether it's through MBBS or whether it's through trying to get into the top university schools in India, we are hyper competitive at times. And therefore, we forget that the best source of learning is not always the professor in class or the teacher. It is actually our fellow students who can teach us much more, right? In healthcare, who is the professor? It is a distributed patient or a patient who walks in the door every day. That is the professor, right? That's the person who's going to tell you you're right, wrong. To a large extent, you solved my problem, you not solved my problem. But actually, we have a lot to learn from each other. I will honestly say there are organizations like the Association of Healthcare Providers, AHPI, the Consortium of Accredited Health Organizations of India, that until I started participating in some of these, I did not have my eyes properly open. I then learned, because we are also an NABH accredited hospital, that look, you can do some things better. We did not achieve 98 point something percent uh, effectiveness during COVID for COVID critical cases because we just followed our customer professors. We also learned from each other. We learned from CMC Vellore, we learned from Apollo, we learned from Medanta, we learned from Hinduja. And I think that capacity to learn from each other and implement it so that it's useful on the ground is a key skill that we need to implement if we're a healthcare provider. And I think that is one of the things that if we leverage our strengths, because India has a playbook like no other, 80,000 hospitals that are participating, looking after 1.3 billion people, 1.3 billion different situations. If we can harness that and that data that may come out of it, we can actually solve most of the world's problems, my personal belief.
So as Samir was saying, it's if I just sum up that, it is the power of T3: talent, technology together. So these three combined, this can transform the healthcare story of India, according to Sami. Dr. Naik, your thoughts on that? Do you think that T3 can transform India's healthcare ecosystem, or do you think that some more T's need to be added?
So I think he Dr. Samir Mehta, I think has hit the nail on the head. I agree with that. There are many T's. It may not start with T, but as you said, bullet points. Uh, Apart from what I have said and what Dr. Samir has said, equity and all those things. But I would think that the most important thing is the patient doctor relationship. If the patient if the patient is not briefed, I think the most important thing in ensuring and sometimes delivering good care, not only giving a good care, but giving time to the patient attendance, I mean, having an eyeball to eyeball connection, developing a rapport with the patient family, especially because I am in a specialty which deals with chronic diseases. You need to have a rapport that develops, and we in India don't seem to mind picking up the phone, whatever time of day or night it is, which never happens in the United States. That gives them tremendous confidence in us. We don't charge for that, though we also practice video consultation and all those things. This is a and advertently or inadvertently, Dr. Mehta spoke about Jugaad. The Indian Jugaad is very famous, and we develop our own innovative ways of treating patients. But the most important thing is developing a strong rapport with the patient and the patient family. If you treat a patient and the patient is happy with the treatment, that is only 50% of the story. You should have a patient who does not do well, and patient may even die, but still they are happy with the treatment and bring their next patient to you because they know that you have done your best. That is the litmus test of a doctor's goodness and the strength of the resilience of their relationship. I would focus on that because in chronic diseases we feel this a lot. So if that breaks, if the patient does well, that's fine, but they probably will always have a complaint. They will say, doctor, you were good, but the hospital, we are very unhappy. So to build that rapport and that resilient system, a patient doctor connection is very important, and that is where Dr. Google comes in and spoils the relationship. But at the same time, you cannot tell the patient, if the patient, there are very, especially if you see the literate, so-called literate, smart husband of the wife. You ask a question to a wife, and even before the patient can, wife or some other adult can answer the question, which is what we are keen of, the smart husband interrupts and answers the question. It happens once, twice, but there is a nice way. Here, there is a risk of you losing the rapport by scolding that person and telling him, I'm not asking you this question. But if you do that, old timers used to do that, and the entire rapport is to break off. So we have to be very smart in dealing with these situations, but at the same time, friendly, in a friendly manner, you convey this thing. And I would like to hear from the uh, from the patient itself what exactly. So that also leads to what is called clinical medicine. In clinical medicine is slowly losing it's all, even without knowing the patient, we are you touching the patient, we are asking for a CT scan or MRI. So that again, these are all rapport building steps. So I would say micro resilience in these, that is also a very important aspect. And people are going to come back to the same doctor and develop a stronger relationship. And some slip ups here and there, you apologize to them. You should not hesitate to apologize to the patient that yes, this went wrong, but we will try to rectify it. So these are my practical thoughts on the issue.
Right. This also brings us to the end of this panel discussion. I thank Mr. Sameer Mehta and Dr. K. Nayak for joining us this for this session. And if I take a crux of what has been discussed for last 30 minutes, 45 minutes or so, that one is equity is very important. Need of the hour is effective, good PPP model. As Sami has said, T3, talent, technology, and togetherness, working to learn with each other. As Dr. Nayak has ended by saying that patient doctor relationship is very important. And also, both of you talked about the importance of government spending more money and allocating more for the healthcare infrastructure. With this, we end the session. But before we move on, this small token of recognition from our end to the eminent speakers who have joined for this session. Can we have the certificates on screen, please? We want to present this certificate of appreciation to Mr. Sameer Mehta, Vice Chairman Dr. Mehta's Multispeciality Hospital, for his dedicated efforts and exemplary work in the healthcare. We congratulate Mr. Sameer Mehta. Thank you so much for joining us today for the fourth edition of APAC HealthTech Innovation Conclave, in which we are primarily focusing on the southern part of the country. We also present the certificate to Dr. K.S. Nayak, Chief Advisor to Board and Chief Nephrologist, Virinchi Hospitals, Hyderabad, again for his dedicated efforts and exemplary work in the healthcare. It's indeed our honor to recognize your efforts, sir. Thank you so much for joining us today, because we are all working together to build that digitally empowered, comprehensive healthcare ecosystem of the future. Thank you so much. Do join us for the next session in half an hour time. Thank you so much. Goodbye. Take care.
Thank you, Souvik. Thank you, Dr. Nayak. Pleasure to meet.
Pleasure to meet you. Yeah.